Welcome back to Diabetic Foot Files. I'm your host, Dr. G. Why your chances of keeping your leg depend on where you were born or where you live, pretty much. A man in a rural community notices a blister on his foot. He keeps working, he cannot afford to stop. The blister becomes an ulcer. The ulcer begins to smell. Weeks later, maggots appear. He wraps the foot in cloth. There's no podiatrist nearby. There's no wound care center nearby. There's no vascular surgeon nearby. And by the time he reaches to the hospital, the conversation is no longer about saving the foot. It's about saving the patient's life because most likely he's septic. So welcome to Diabetic Foot Files. Today's episode is simply not about diabetic foot ulcers, but about geography. I've noticed the hierarchy of medicine, and I'm not talking about like people like nurses, doctors, nothing like that. There's a hierarchy with that as well, but I'm talking about that the rich can afford better healthcare than the, the middle class or people in poverty, and that health, high quality health, should be a birthright for anybody. And I've noticed that because if you go to the wrong hospital, you might just end up dying. But if you go to the right hospital with the right insurance, there's great chances that you possibly will live. Okay. And personally, I've had my own share of family relatives that have passed away due to poor neglect. If they were in a different hospital, I am 100% sure they would have lived because they had better access to healthcare, better resources, and that should not be because death is irreversible as I know it now. So that's how it should be for everybody. Everybody should have high quality healthcare, but nobody cares. Nobody's talking about that. Everybody's talking about if your insurance can cover this, okay? Because in modern medicine, where you live does determine whether if your ulcer will heal, does determine whether you walk again, does determine if you will lose your leg. You have to think about this because today we're going to discuss about why wealthy nations invest billions into limb preservation, why amputations explode like they thrive. They do so many amputations in low income countries. The economics behind wound care, the colonial history of healthcare systems, why prevention fails globally because it doesn't make them money, right? And why diabetic foot ulcers may be one of the clearest mirrors of inequality in this earth. So everybody should know that diabetes is a global epidemic, okay? It's one that nobody talks about. Diabetic foot disease is one of the largest silent epidemics in the world. Research estimates that diabetic foot ulcers affect between 19 to 34% of people who has diabetes during their whole lifetime, okay? And that means millions of people globally will develop a foot ulcer. And the terrifying part is a diabetic foot ulcer is not just a wound. Once we get to the diabetic foot ulcer, usually is the beginning of hospitalizations, infections, amputation, cardiovascular decline, and early death. And like they always show, studies show that there is a 5-year mortality rate after a diabetic foot complication can rival and exceed many cancers, okay? And major review found that 5-year mortality after a diabetic foot ulcer is about 30%, okay? And after a major amputation is like 56%. So think about that. More than half of patients may be dead in 5 years after a major diabetic amputation. And this is not a foot problem. This is a systemic disease problem. And this is our healthcare system. So there are two different worlds. Now, two different patients. Same ulcer, same bacteria, same diabetes, same hemoglobin A1C, everything, but two different countries. So patient A is in a high income country. A patient in a wealthy healthcare system may receive vascular imaging. I've had patients who live here and they fly to a different country because they know that that's better healthcare. Why is that? Because they know they want to save their life, save their limb, save themselves, right? But if they stay here, let's say in a developing country where the healthcare system is very much compromised, no, your chances of living is very low or by the grace of God or by luck. But honestly, the healthcare system is very compromised in low income countries. I've lived it. Okay. So nobody can tell me anything. I've seen it firsthand. My dad died here because why? He died in the Bahamas because the healthcare system is compromised. There's not enough great resources there. He survived and did extremely well when he was in America. It just so happened that he had a heart attack there, right? And they provided the best care possible, everything. They were fantastic. But here, all he did was have a fall, and then 2 days later, he's dead. Because they were just practicing. They didn't even know what they were doing. They were blind. Even the doctor, the rich cardiovascular doctor who I took him to, literally, when I messaged him, I was like, oh, he's in the hospital, whatever. He's like, I really hope they know his review system. I really hope they know what they're doing. They didn't. They didn't. He knew that they were going to mess up and kill him. That's what they did. And nobody can change my mind about it. Those people at that hospital killed him because of the poor resources, the poor way of handling things. So forgive me. There's some maintenance issues going on in the background, but forgive that. So let me get back to the high income. A wealthy patient in a wealthy healthcare system will receive vascular imaging, MRI evaluation, infectious disease consultations, podiatry care, offloading boots, biological grafts, hyperbaric oxygen, multidisciplinary team. The goal is to save the limb because high-income countries, amputation is viewed as a failure. Now let's get to the low-income country. So low-income country, now imagine the same patient in a low-income country, different environment. There's no podiatrist around. There's no vascular surgeon. There's no wound care clinic. Limited insulin for the patient. Limited antibiotics. No offloading device. The patient have to pay out of pocket for that. No transportation. The patient may continue walking on the wound for months because missing work means not eating. And by the time the care is reached, the patient's already septic because, might have gangrene that spread, ischemia may be irreversible, and, amputation becomes the solution, not because the limb could not have been saved, it's because the system could not save it. In low income, there are some great doctors, but there are some doctors that should not be doctors, and that's the truth, okay? Sorry, if your goal is not to help save lives and, make the patient quality care of life better, and you're just here just to hear people call you doctor, please, yeah, those are the people that, yeah, because I've lived in low income countries. I've seen it firsthand. One thing my residency always taught me is how to diagnose necrotizing fasciitis. I had an incident where these people thought it was the flu. Necrotizing fasciitis, they thought it was the flu. That's how they diagnose people here in the country that I was born in. Okay? That's how, okay? So let's talk about the brutal economics of limb salvage. The uncomfortable truth is wealthy countries become interested in limb preservation partly because amputations became too expensive. Major amputations also creates repeated admission, which is true, rehabilitation costs, prosthetics, nursing care, disability, workforce loss. Those patients they will need their disability and their work compensation, cardiovascular complications, and the healthcare systems in these wealthy countries realize that saving a limb is often cheaper than losing the limb. And the economic realization fueled wound care research, vascular surgery expansion, podiatry, and diabetic limb salvage programs. Limb preservation becomes economically valuable. So why do low-income countries struggle? Low-income countries often face a completely different healthcare reality. Historically, many healthcare systems focus on things like malaria, HIV, AIDS, cholera, tuberculosis, maternal mortality, childhood infections, and those systems are built on acute survival medicine. But diabetes requires long-term monitoring, prevention, which is the best thing, infrastructure, continuity of care, education, and a multidisciplinary team. Okay. And many nations never receive the resources that is needed to build those systems. Or if the government does have those resources, they use it for the wrong reasons, in my opinion. Because if you're thriving, if you're making money, and the country and public system, healthcare system is still poor, like I'm telling you, there are times there was no gauze. Why is there no gauze in a public clinic? Why is it so limited? That does not make sense if you're driving a car that is worth six figures. This does not make sense. None of this makes any sense, okay? None of it makes any sense. How are y'all building new buildings, but the patients still have to bring their own wound care supplies? Does this make any sense? What's the whole purpose of healthcare? What's the whole purpose of having a public clinic that patients should be able to receive the highest quality of care, I believe, okay? Because I believe high quality care, healthcare, it should be everybody's birthright. Everybody has the right to live, correct? So why is that not a birthright for everybody? High quality healthcare. Okay? You know, I was thinking, I think I think teaching hospitals are great because honestly, those are fresh eyes. Those are, you have attendings and teachers. They're teaching as well. So these are like one of the most academically strong environments for you to be seen at. Okay, teaching hospitals, right? But if they're not presenting like the best, and there's no whistleblowers, if there's nobody who's speaking up and saying, hey, this is wrong, this is bad for the country, these patients are not getting the health care that they need, or this person keeps on misdiagnosing wrong, right? What are they supposed to do? I didn't even know in the country that I was brought up in, right? The public care system is horrible, okay? The people are afraid to go to the hospital. It's like, if you go there, there's a very high chance you could die, okay? Mortality rates is high. And it's not because the people can't live. It's because the resources are limited. There's lack of people who care enough to, I don't care. I don't care. We've all been overworked. Okay, we all been overworked. If you've been in residency, you've been overworked. Okay, it doesn't matter because that's the whole point. That hearing a soldier complain about being overworked, you're like, you're a soldier. That's what we're soldiers in the hospital, okay? The whole point of us being there is to help save the lives. Work till the end. I know there's something called burnout. We've all been there, okay? But either you stay or you go, okay? And I'm not in the mood for that because these people want to save their lives. And then on top of that, if it was you, you're going to go somewhere where you know there's the best quality healthcare because you want to save your life. You know, I kept on proposing that if they think that these public clinics that are in not the best condition, do not provide the best healthcare, with the patients that I have, they do not trust it at all, okay? Because they see how they're treated, what happens, and on top of that, they still have to go find a referral or something like that, right? If you think that the general public deserves this type of health care, now there is somebody, okay? There is a person who's responsible to say, this is what the public deserves, right? Because it's free. This is what the public deserves. If you are responsible for that, you should be getting that same health care. I believe that if you are a member or the head and you're saying this is the healthcare that the public deserves, you should be getting that healthcare too. You should not ever go. If you are deciding what the public deserves, you can only get healthcare from the public clinics. That's what I believe. If you are deciding, saying this is what the public deserves, you should only go to the public clinics. And if you go to a private clinic to get healthcare, you should get fined for $100,000 or more if you go to a private clinic. Because if you're responsible for what the public deserves, if you're saying this is what the public clinic deserves, this is how many gauze the public deserves, then you should go only to the public clinics, because then you will see where the gaps are, where the cracks are, and you can see exactly what it needs and what it's not. And if you don't think it's good enough for you, why do you think it's good enough for the general public? Why do you think that is good enough for the general public if you won't go to the public clinic yourself and only be treated there?
You should only be treated at the public clinic. If you're responsible and you're the person who holds the key with the money, how much the public clinics get or whatever, you should only go to the public clinics. Never go to the private because you think this is what the public clinics deserve. Okay? That's my 5 cents, okay? So let's continue. The podiatry gap. One of the greatest global healthcare inequalities, okay, is the lack of podiatry. I love me podiatry. Some countries have thousands of podiatrists, diabetic foot centers, limb salvages, conferences, surgical podiatry residencies, and other countries only have a handful, and some countries don't even have any. And with podiatry, without it, calluses become ulcers, ulcers become infections, infections become amputations. And because diabetic wounds are biomechanical diseases too, right? Gotta think about it. Pressure matters. That's why offloading is key. And without specialists that are trained in pressure redistribution, gait analysis, offloading, footwear, preventative screening, the entire prevention system collapse. So another thing people don't really talk about, poverty actually does change your wound biology. This is critical. Remember, we talk about nutrition. Poverty does not just affect the access to healthcare. It affects how you heal itself, because healing requires what? Nutrition, protein, glucose control, rest, dressing supplies, transportation, time off. Now imagine somebody standing all day for labor just so they can pay their hospital or work or office visit bill, walking long distances, refusing to reusing their dressing. Some patients reuse their ACE bandages because they can't afford the supplies. And sorry for the thing in the background. I always go by the window. No refrigeration for their insulin, possibly. Poor shoe access. There are people out here selling shoes for patients that you know need it. They need it. I'm sorry. Don't say I'm sorry if you can't afford it. Give them the shoe. Give the patient a shoe. I'm not the economic person, okay? I'm the person who's supposed to heal the person, okay? So let the economic people handle that. But you should never say, that's the Hippocratic Oath, do no harm. And if you can say no to a patient because they cannot afford a post-op shoe, that's harm, okay? Also, crowded housing, inability to afford a follow-up, okay? Patients are scared to follow up. I've had patients scared to follow up because they cannot afford it. And I'm not responsible. I just say, see me. Just see me. That's fine. That's fine. Just see me. That's fine, okay? The wound environment has become hostile, especially in low-income countries, okay? The body is healing from chronic inside stress. I had one of my patients, she was stressing out because she couldn't pay. I was like, no, don't worry. That's not why I'm here. I don't care if you pay me 3 months from now. I don't care if you never be able to pay me. I want to see this close. That's me, okay? That might not be you. That's how my daddy was. That's I don't know. Because honestly, if you can do anything for money, you will do anything for money, including letting somebody die or letting their wound get worse or letting their leg come off, okay? So why has amputation become normal? This is one of the darkest parts of the story. When clinicians repeatedly see advanced gangrene, amputation becomes, psychologically normalized. People say, oh, diabetics always lose them. I had a patient tell me that the doctor said, once you lose one toe, you're going to lose the rest of them. I say, oh, wow. I didn't know. That sounds like I don't know, like a riddle or something. I'm like, why did he tell you that? That's not true. That you are at risk, but that's not true. That made I asked the patient how that made you feel. He said it made me feel depressed. He said, I believe I can heal. He said, I believe I can heal. He said, I think I'm a good healer, but they always want to cut off my toes. So he contacted me. Yeah. And we kept the toe. Okay. So, because he can heal. He had good blood flow. He could heal. They just kept on cutting off his toes. I told him the truth about the biomechanics and, hammer toe in terms of my foot, all that jazz, right? But if the patient wants to keep their toe, knowing all the risk, let them keep the toe, okay? This is called a normalization of a catastrophe, saying nothing can be done. They came too late. Diabetics always lose their limb. That's something. And once society normalizes amputations, urgency disappears. People are like, oh, okay, we're just going to cut off the limb, right? Prevention weakens. Governments stop prioritizing limb salvage, and the tragedy becomes routine. So the numbers are devastating. So Like a multi-center study in Nigeria found extremely high rates of severe diabetic foot complications among hospitalized patients with ulcers. But researchers also noted that low and middle income countries face some of the highest risk of diabetes related complications and amputations globally. In Ghana, researchers observed that while amputation have decreased in many high income countries, the burden remains severe in parts of sub Saharan Africa. So, meanwhile, studies in these high income countries show that the multidisciplinary diabetic foot clinics significantly reduce amputations. Why? Because the system matters. Not miracles, the system. But in these low income, they're not caring about it, okay? Because they don't have the resources, okay? Or the government is not delegating the right resources at I shouldn't see. Here's another thing. I'm just going to be 100% honest, okay? If the people are hungry, can't afford groceries, okay? Can't afford wound care products, I shouldn't see you going up a bunch of sizes. Because that's just greed. That's definitely Animal Farm. Because if the people are hungry, why are you not hungry? It's called shared accountability. If they are hungry, why aren't you hungry? Why is the people responsible for the well-being of the public not hungry? Why are you not hungry? If the people are hungry, why are you not stressed out about not having wound care supplies and stuff like that? If you're responsible, if you're the key holder, if you're the one who's holding the money for the general public. Another part that not much people discuss is most people think amputation is an endpoint. It's not. That's the truth. It's not. It's often the beginning of an accelerated decline, which is true. Like we said, the overall 5-year survival rate after a diabetic foot amputation is about 49%, 50%, right? But after major amputation, survival drops catastrophically, and another review showed more than half of patients undergoing major diabetic amputations, yes, may die after 5 years, okay, unfortunately. Because amputation isn't just an amputation. Amputation is a marker of vascular disease. That's one of the biggest things. Like I keep on saying, I think the best thing a diabetic patient can do, the moment you get diagnosed with diabetes, have a vascular surgeon. Have a vascular doctor, get a vascular workup at least once a year, depending on how, if there's any advance. I promise you, it's not just about your foot. It's about your cardiovascular system, your whole blood system, your whole body system. Your kidney, think about it's also a marker of kidney disease. It's also a marker of systemic inflammation. Remember, diabetic foot ulcers are stuck in inflammation a lot of times. It is a marker of cardiovascular collapse. So the foot was warning us the whole entire time. The foot is actually the last one, in my opinion, that is waving the flag of surrender and saying, this is overwhelming for my body right now. So let's talk a little bit about the Caribbean, okay? So the Caribbean faces a dangerous convergence. There is a rising of diabetes, obesity, hypertension, vascular disease, and limited specialist access. And if they're specialists, they do overcharge, okay? Because like I said, if you can do anything for money, you will do anything for money. Like let somebody die because they cannot afford your supposed to be expertise. Many islands may have very few podiatrists, limited wound care systems or centers, delayed vascular access, and shortages in diabetic prevention programs. And amputations quietly devastate families. They don't understand that. People think it's just, oh, you're just removing the dead part of the body, right? No, it's not. Like, it's an infected part, yeah. But limb salvage changes everything. I had a patient this is an older patient. She's so sweet, but she was like, I just want to go home and walk on the beach again. And they wanted to cut off her legs. And I was like, yeah, we're going to get you there. We're going to let you walk on the beach again. And this patient also wanted to donate. And I was just like, wow, like regardless of anything, you wanted to just help people still, even though the government and the public healthcare system didn't want to help you. They wanted to just get rid of your lower extremities, I'm like, this person was so sweet, But like I said, amputations quietly devastate families. When people are sick, it devastates the whole family, okay? Of course it does. And not just physically, economically, emotionally, spiritually. Limb loss may mean unemployment for a patient. I remember I had a patient, all they kept on talking about was the unemployment. They didn't receive unemployment yet. They needed the paperwork. I'm more than happy to. And I appreciate them because they had a very demanding weight bearing job. They couldn't be on their foot because the people wanted to cut off their foot. They didn't want to lose their foot. So they had to do what needed to be done so that we could keep the foot, okay? And they're more than happy to, but the the unemployment benefits took a very long time to come in, you know? And I give my patient some credit for keeping to the system to have it closed because it's all worth it. It's all worth it. Limb loss, like I said, may mean unemployment, inability to provide, depression, isolation, dependence, and loss of identity. And then the human side, okay, like we have to think about it. Amputation is not just anatomy. The leg means independence for a patient. Leg means mobility for a patient. Leg means dignity for a patient. Legs means masculinity for the men. Leg means motherhood for the women, femininity. Leg means employment. Legs mean freedom. And in some countries, losing a leg means losing survival itself. And that is why prevention matters, okay? Not because the wounds are interesting. I think wounds are fantastic and they're interesting, but I care about the human matter, how it changed. I've seen what a physician's decision can do to your entire life, okay? I've seen somebody who doesn't care about the well-being of a patient, see how that changes the whole trajectory of not just the patient, let's say the patient possibly died, but the trajectory of everybody who was connected to them and loved them, okay? So what actually works? Many amputations are preventable. That's the whole point of this. Researchers repeatedly show that multidisciplinary diabetic foot programs reduce amputations dramatically. What low-income countries truly need is not always a multi-million-dollar technology. They need screening. They need to care. They need education, podiatry, community wound care, affordable offloading, vascular referral systems that work, and people who do not care about the money. Glucose management, early detection, simple interventions save lives and limbs, okay? This is not something that is rocket science. This is not the Da Vinci Code, okay? It's about it mattering enough. Because one thing I do know, everybody does want to save their life. And when I see the people of extremely high income, let's say the people in charge, right? If they're sick, they do not go to the public clinic. They might even go abroad. They they think that the healthcare system is better in a different country, a high income country, and they want to save their life. But you won't stay in the same country that you're benefiting on the land, the public, the general public voted you in, and you went abroad, and you won't stay and get treated in the public hospital or the public clinic. Does that make any sense? Tell me if that makes any sense. So let's talk about the future of limb preservation. Future may include, of course, AI wound screenings, smartphone thermography, telemedicine, low-cost offloading, portable vascular testing, community healthcare workers, local podiatry training programs. Technology may, democratize wound care globally, possibly, okay? But technology alone does not solve the indifference because the biggest problem is not scientific capability, it's about priority, okay? Two people can develop the same diabetic ulcer and live completely different countries and have completely different outcomes. One receives limb salvage, one receives amputation. Not because the biology is different, but in modern world, no one should lose a limb or leg simply because where they were born in the wrong healthcare system. The diabetic ulcer may be one of the most honest maps of inequality on the earth because sometimes the difference between healing and amputation is not medicine, it's about where you live. And this was Diabetic Foot Files. Sorry if I sound aggressive. And I'm Dr. G. And take care of your feet because they take care of you.